Welcome to this second episode of the new podcast on body politics in the 21st century. The Cambridge Centre for International Research has given me the great opportunity and challenge to explore what we do to our bodies, who gets to decide what is good, healthy, or beautiful in bodies, and why we follow this guidance and norms. And in the 6 episodes of this podcast, this is the second one, I welcome a different expert in each episode, and we chat about different parts to these questions of body politics in this century, ranging from plastic surgery to body image in the first episode, to self-tracking and technology and what this has to do with our bodies today. And for the second episode, I'm really, really grateful and delighted to welcome Debra Lupton, who's the Sharp Professor in the Centre for Social Research and Health and the Social Policy Research Centre at the University of New South Wales. And this also explains why it's really dark here, because we had to work around an 11-hour difference, time difference. So I'm really grateful that Deborah made that work and agreed to do this despite a bit of logistics involved in this. Deborah has written extensively on a range of topics, so it was a bit of a challenge for me to pick out something for this shortish episode because there's just so much we could talk about. So she's written on self-tracking, risk, food, sociological approaches to, everything that sort of concerns us, including COVID-19 recently. And her latest book, Data Selves, explores the immense amount of data that we produce and how this data shapes us in return. And today we'll talk about, as I said, a couple of different aspects of tech and how they influence our bodies and why we so openly share our lives and bodies on social media. And we will end with one topic which I found just so intriguing, so we had to cover it, which is cheat days videos on YouTube. And I feel like I've never read academic research on this before, so I felt it was just such a good topic to cover. So thanks so much for Deborah for joining us today.
Great to be here, Ronja.
So I want to start us off with one topic you'll explore in a couple of papers, which is that technology is somewhat of an extension of the body. So it somehow becomes part of who we are. It's just not something that's there, but it's part of our body. Can you just explain that a little bit more? Because it seems that we have used loads of different objects in our environment very much as we use technology. So maybe before technology, we really hung on to like photo albums or something, diaries that reminded us of what happened in our lives. So in what way is technology different? How is it part of our body?
Well, it is different, but it's also an extension of the ways that we've used objects to kind of define ourselves and our bodies, extend our bodies' capacities, present ourselves as individuals. So if you think about clothing, for example, that the types of clothes we choose to wear are very much part of how we like to present ourselves to the world, and very much part of our personas and our social relationships. So that's just one example of many, many other examples. And I became really interested actually in computer technologies in the early days of personal computing, because I'd already been interested in the sociology of health and embodiment. My PhD was actually on HIV/AIDS and how that particular new, at the time, epidemic was represented in the Australian press, and the metaphorical ways that this new viral illness was talked about, and not only that, how certain individuals and social groups were singled out as being at risk or risky to others. And of course, there was a lot of stigmatization of certain social groups in the early days of the HIV/AIDS epidemic, particularly gay men, injecting drug users, sex workers, and so on. So I was very interested in how the public learned about this new epidemic, as it was back then in the early 80s. We first learned about HIV/AIDS in 1981 with this mysterious new illness, which kind of have resonances for how COVID was first talked about a year ago when we first learned about COVID. And, I trained in the sociology of health. I also trained in the sociology of everyday life as an undergraduate. I was really interested just in everyday practices and the ways that we use our bodies, the types of food we eat, things like clothing, things like leisure practices, So I've really been researching those two dimensions, sociology of health, sociology of everyday life, for forever. And then personal computing became a thing in the late 1980s. And suddenly, you know, the little Macintosh desktop computers started to appear in university libraries and
Yeah.
workplaces. And I was still a student then, so I was one of the early adopters. I just basically used them as glorified word processors because they really didn't do that much else back then.
Yeah.
No internet or anything, so they were just very handy for that. And actually, my interest in HIV/AIDS led on to my interest in computers as a social phenomenon, because I started noticing in the mid-90s the way that the viral metaphor was used, computer viruses.
Mm.
That was a metaphor that was chosen to talk about computers malfunctioning by sharing problems with, by basically floppy disks back then. If you
Yeah.
shared your floppy disk with someone, you might infect your computer with a
Yeah. Yeah.
virus. And there was quite a bit of a moral panic about that in the mid-90s as people began to be aware of what can actually happen to their beloved personal computer if they shared floppy disks. And I could see a lot of resonances there with sharing bodily fluids, and
Mm.
infecting your body to infecting your computer. So I started to write about how we think about computers as part of our bodies and our social relationships, just drawing on that notion of infection to begin with,
Yeah.
because I thought it was really quite fascinating to think about, the embodiment of what I call the computer slash user. So I was already in the mid 90s starting to think about our bodies and selves as already part of our computing practices. And since then, I've actually started to use more than human theory a lot more than I did back then in the mid 90s. And that, for example, in my recent book, Data Selves, that's really a theoretical approach I've really tried to expand on. Because, of course, now not only do we have computerized technologies that now can live on us, with us, we wear them, we carry them,
Mm.
they even can be inserted into our bodies in terms of some medical devices. But of course, they generate data about us, which is what they didn't do back in the early days of personal
Mm.
computing. And I argue in my Data Selves books that we should think of these personal data about ourselves as a form of human remains, like we think of
Mm.
cells or body organs that are also commercialized and commodified. If you look at this sort of market for human sort of organs and gametes and even surrogate parenting,
Yeah.
uteruses and so on, and embryos, we can start to think about our personal data in a similar way, because as we all know now, because of the commodification of personal data by third parties, they do have a lot in this age of big data, they do have a lot of commercial value as well as personal value to us. So I guess that's just, a prodded history of how it is I've sort of ended up where I am now, looking at these aspects of data and technologies. But going right back to the early days of personal computing and my interest in embodiment and selfhood when those technologies started to emerge.
That's so interesting to hear. And I mean, so many things came to my mind when you talked about this. One is that when you talked about like being interested in sociology of everyday life, I feel like I really started to appreciate what might be interesting about that. And I don't mean that in like a negative way, but just in the sort of, you discover that during this pandemic, because I feel like, I don't know, maybe at least in my generation, like nothing has ever disrupted my life that much as this pandemic has. And of course, it's true for a lot of people, but I feel that these past months have driven me to just interrogate so much like the small practices we so readily adapt as a consequence of this pandemic. And just thinking about like what sort of walks, like what sort of importance like just going outside has acquired, and this is like ritual and symbolic value suddenly to like being outside and this kind of stuff. And I was just thinking that for the first time I consciously thought about what the symbolic value and what it means to me, like the tiny things that constitute my everyday life because it was suddenly disrupted. So I absolutely, like, I see why, you would be interested in that. And I feel like this pandemic has really shown me like how it can become so important, this sort of sociology of everyday life. The other thing that you said, which I thought was really interesting, is that you became, you were invested in researching about technology basically from the start. And I wonder, like, what do you think how you, as someone who has sort of seen this whole development, what do you think the biggest trends have been? What has like materialized that you thought, you maybe hypothesized, very early on or something like that? Because at least for me, I mean, of course, I have grown up around technology a lot. And for me, like calling something a virus, like I don't think twice about it. I don't think about where this terminology comes from. And I think that's, probably even truer for the generations after me.
Yes, definitely. It's interesting to have been around long enough to have seen the development of digital technologies from those very early kind of very simple when you think about it, and very non-portable.
Yeah.
I mean, they were fairly chunky things. Even the early laptops were quite heavy. I did have an early one. It was quite heavy to carry around, and as I say, it didn't connect to the internet. Then we had the modems that you had to connect, literally plug into a phone line and so on. Yeah, so a lot of interesting changes over the past 30 years or so. So I would say that one thing I've really noted and thought about too is back when social researchers and theorists were writing about people's engagements with digital technology in the early days. Of course, cyber was the word that we used. It was going into cyberspace. It was having cyber bodies. There was sort of cyber sexuality, cyber bullying, cyber, crime, and that was very much the whole cyber discourse was very prominent in the 90s. And there were a lot of us who that was the terminology we used back then. I certainly did, and everyone else did. That was just the way that we thought about digital technologies and thought about, used those terms when writing about them. And I've certainly noticed the lack of that terminology since probably the turn of this century. Things started to change from the early 2000s. We don't, and we now talk more about digital technologies, really just using the word digital to encompass the vast array now that we have of the devices that are digitized. And what I've also noticed too, and I was quite critical of this at the time, was the way when the early theorists were writing about cyberspace, there was a lot of talk about how the ideal was to leave the fleshly body and go into cyberspace somehow. There was this whole kind of imaginary around leaving your body behind, and this notion that you can be anyone you want to be in cyberspace because nobody knows who you really are. And there was that old joke that, nobody knows that you're a dog in cyberspace or something. And, people could play with their identities and their sexualities and, their embodiment because other people couldn't see them. And there was a lot of that going on the early discussion boards, early kind of dating sites. And, there were pros and cons because there was also a lot of, I guess, trolling that went on. There was a lot of sexual abuse that went on, grooming of young children and so on. But of course, that kind of, well, of course, we've never reached and we won't ever reach the point where we're, all floating around in cyberspace, which is physically impossible. Whatever the science fiction people like to think about the singularity, that remains an imaginary. But of course, these days, everyone knows you're a dog on cyberspace. You can't hide your identity as easily as you could back then. So that's something that I've really, really noted. And that gets back again to the way that our digital traces are tracked. Well, firstly, how we generate them, but then how they are tracked and used and accessed by other people, and how difficult it is these days to protect one's digital privacy. That's a huge change from the 90s to now. And along with that, of course, social researchers have been very interested in how notions of privacy have changed, how we understand how to protect our privacy, how important we think it is. And it's a very nuanced field because it's so contextual. And I think that's something that's often, I've been a bit critical in some of my recent writings because I have written a bit about people's understandings of digital privacy and their practices related to digital privacy. And what I argue is that a lot of, well, some of the writing on digital privacy in recent times has tended to be a bit overblown. For example, I'm a bit critical of Zuboff's Surveillance Capitalism book because when you read it, it's very full of hype. It's all about how we are all, everyone, everyone is at all times tracked and monitored and exploited, and we just don't know it, and we should all wake up to it and challenge it. And, these third parties are sucking the very lifeblood out of us and selling it. And I just sort of say, well, look, because wait a minute here. This is really, for one thing, it's very generalizing. And as someone who doesn't live in the US, which surveillance capitalism pretty much exclusively focuses on, in the US, say, versus Australia, we're both wealthy global north countries with very, Anglophone countries. We have a lot of similarities, but we have a huge number of differences as well. And so for us living as Australians in the context of how we are tracked and traced and how third parties might use our personal data, it's gone nowhere near as far as it has in the US, for example. Yeah. And my research with Australians shows that Australians can't really, they say they're not worried about digital privacy because they've never really been affected by it yet. They haven't been affected. I mean, yes, we've been part of breaches and leaks and stuff, but it hasn't really had a material effect on our everyday lives. We read about it and, oh no, my data's been leaked or hacked or breached, but, how has it affected me? Well, it hasn't, yet. So I really do think we need to think more about when we're talking about digital privacy, which is a very hot topic and a really important topic, but we need to understand that it's so contextual. It depends on what country you live in, even what region or city in that country you live in. It depends on your age, it depends on your gender, socio-demographic status, whether you're already a very disadvantaged minority group or whether you're a privileged group. There are just so many dimensions to it. So as a sociologist, of course, I'm really interested in those dimensions, those social dimensions. So it's something I really try to push in my own writing, just constantly talking about the nuances and the complexities and the situated nature of how people engage with digital devices and their digital data and notions of digital privacy. And that gets back to everyday life because I often do talk about the mundane aspects because you read books like Surveillance Capitalism, it's not about the mundane, it's about this sort of extraordinary, it's about, doom and gloom. And what I like to do is bring it back to, well, what are actual everyday practices? What are people doing? What are people thinking? How are they, I've done some work on how people responded to the Cambridge Analytica scandal around Facebook a couple of years ago. And basically people in Australia didn't even, 6 months later, didn't remember it, didn't worry about it. It went completely past them and they were still using Facebook. Nobody left Facebook. Well, some people did, but, in the terms of the vast number, Facebook usage has grown since Cambridge Analytica, in Australia and elsewhere. So, so that's always the sort of minutiae of everyday life and how people make sense of digital technologies, how they incorporate them into their everyday lives and habits, or how they may choose to give them up. And that does get back to the whole self-tracking phenomenon as well, because in my book, The Quantified Self, the subtitle was A Sociology of Self-Tracking. I didn't want to say the sociology, so I wanted to say that this is only one version, one way of thinking about the social dimensions of the quantified self. Excuse me. So what I did in that book, it was actually mostly a Foucauldian analysis, but I do start to bring in a little bit of the more than human dimensions, so just the understanding that we are always already more than our bodies. We are always engaging, just sitting at our desk and our chair, not to mention the fact we're using Zoom, but, wearing clothes, sitting on a chair, They are very simple analog ways that we are more than human.
Yeah.
And then we add on the digital layer as well. So we are always part of these digital and non-digital or more than digital assemblages in every second of our lives. You know, we can never say that we are fully autonomous bodies or selves. And that includes with other people. You know, we move through our worlds. There are other people sometimes in the room or in the space with us, sometimes not. But we are always part of these assemblages of humans and non-humans. So that's the sort of approach that I've really tried to, and bringing that back down to the contextual nature of that,
Yeah.
and the fact that it's constantly changing as we move through our lives, move through our physical worlds. So I'm really sort of, with all my research right now, I'm really trying to focus on those very complexities and the very situated nature of those complexities. And yes, they may be very mundane, but that is the only way we're really going to understand what's going on with people's lives and experiences and understandings of digital devices and data.
Yeah, the example of Cambridge Analytica is so interesting because I very much agree that I think often when we read about data privacy, anything related to how much our devices track, there is definitely this doom and gloom feel about it. So do you think that, you mentioned that people, they didn't stop signing up for Facebook. In fact, as you said, numbers went up. Do you think that is because we don't appreciate enough the positive effects this type of technology has for people, so that people actually enjoy it, it brings something to their lives, we just overstate basically the negative threat? Or is it more a question of people just being bad at evaluating risks of privacy, that we just don't take it seriously until it happens to us, so to say?
Well, I think it is difficult to take anything seriously until it happens to you. You know, you can
Yeah.
see that in the people, particularly in the US, who refuse to wear face masks in the risk, given that even despite the fact that COVID's running rampant through their country and has been for months and months. And incidentally, with my postdoc team, I've written a book on this social dimensions of face masks, which
Yeah.
gets away from the focus on digital technologies. But, you know, that isn't, I do write a lot about digital technologies data, but it's not everything that I am interested in. And again, it gets back to the mundane aspects. What is it about wearing or not wearing a face mask that is so symbolically significant to people? And it does also get back to how they understand risk, but it's way more than that. It's a political thing. It's even how the mask feels on your face. It's the climate that you're wearing it in. You know, wearing a face mask in a very hot, humid climate is very different from wearing it in an icy climate where it might actually freeze on your face, for example. There's again, the context is really important. The political context in which you're operating is really important. Just getting back to issues like Facebook use. So I have recently published an article about that does focus on that project I did on people's attitudes to Facebook and why they continue to use Facebook in Australia, even a few months after the Cambridge Analytica scandal. And what I showed there is people get so many different things out of Facebook that might be great for your business. It might be great because you have friends and family who live, you know, quite a way apart from you, and it's really the only way to keep in contact. You might be a grandparent, and that's a really great way to see videos and photos of your grandchildren who live a long way away from you. It might be because you have a disability and find it hard to leave the house. So that's a really great way to talk to other people with a disability. You might have a rare disease. You might have a child with a rare disease. And I've also done work on Facebook groups for chronic illness. And people find being able to talk to other people about, you know, specific interests or concerns, you know, through I don't think enough is said about Facebook groups, actually. That group, the way that the groups that you can set up and join in Facebook is a really great way to make a community all over the world, as big as you want it or as small as you want it. It can be a tiny little group, but of people who have a very, very narrow focus. And One example is a man I spoke to in Australia who had a special, who was said he was in a wheelchair, so he wasn't very mobile, but he also had a special hobby interest. And he said he only had about 9 Facebook friends, and he doesn't like to share his real name or share information about himself. The only thing he uses it for is to be able to chat to people about his hobby around the country, you know,
Yeah.
and then you get other people who have literally thousands of friends, and they're using Facebook for lots of different reasons because they may have an interest. You know, if you look at the different interest groups on Facebook and how narrow they can be, it's just incredible, you know.
Yeah.
But it's a way to find people who share your interest all over the world. A really great way because Facebook is such a prominent platform, so there are so many people on it. It's just a great way to find people like you, like-minded people. So those are the sorts of very positive things about Facebook that keep bringing people back to Facebook. And it's not as if they don't know that Facebook is making money out of their personal data, because of course they see the individualized ads that, you know, we all get on Facebook. They're not stupid. They know that that's being,
Yeah.
you know, their data are being harvested, but they haven't really seen a reason. I mean, that can be annoying to get those ads, but you know, is it a reason to leave Facebook? No, for most people it's not.
I mean, that you mentioned Facebook groups is so interesting, because I noticed recently that Facebook itself really pushes the group factor in their advertising recently, which I've never noticed before, but I feel like the adverts I've seen about Facebook really push this idea that you can, as you say, meet like-minded people in Facebook groups. So it seems that this is something people use a lot at the moment, or Facebook, you know, wouldn't choose to advertise this specific feature. So I think it's really interesting because, as you say, I think it's one feature of social media we've not talked about as much. You just use it and you just assume it's there.
Yeah, I think
Yeah.
it gets back to the social use of Facebook as opposed to the individual use. So Facebook's often talked about as a platform where, you know, you do your status updates, you post your photos and videos, you talk about what you
True.
had to
Yeah.
eat or whatever, or where I went this. But of course, the groups is a community. They're a community kind of phenomenon. Yeah, so it's a much more tailored way, much more customized way of using Facebook. And I should also mention that, of course, with COVID, and as you were mentioning earlier, then Facebook has become, and other platforms like Facebook, where one can communicate with people outside your own bubble
Yeah.
or household. It's become even more important. And I have actually done research as well, talking to Australians about using digital technologies post-COVID. In our first, we've only had one national lockdown in Australia, and so I did interviews with people about their experience of COVID in that first lockdown that we had, and they did talk about still being able to, you know, the wonderfulness of being able to communicate with friends and family that they weren't able to see in person via platforms like Facebook. But of course, video messaging was really suddenly became
Yeah.
a really
That's true.
FaceTiming,
Yeah.
you know, or Zoom or whatever platform you were using, suddenly became very well used, not just for work purposes, but for just everyday life, for people to communicate with friends and family. And it was really important to them.
I think another really, I mean, I guess tragic but interesting aspect of the pandemic and body and technology is that there's been this drastic shift, which I don't think has been there before, from that we often document our lives and then put it on Facebook, but we document other people and ourselves with technology. And now we are forced to experience reality through technology. We don't just document reality with technology, but we only are able to access it in the first place through technology. So, I mean, the really grave examples are, you know, that funerals are just held via Zoom, or births or something along those lines, where the very beginning and end of a life is not only that we document it with the technology, is that we live it through it. There's no way to experience it apart from that. And what do you think, how do you think will that change how we relate to technology in our bodies?
Well, I think it's meant that people have realized the more positive dimensions of technologies over the past year of COVID, which gets back to the importance of social researchers of acknowledging, yes, there are
Mm.
drawbacks, but also there are positives of using digital technologies, because we can become a little bit too obsessed with the negative sides of things. But I think it has given people a renewed um, kind of acknowledgement
Yeah,
that, I mean, what would we have done if we didn't have
true.
digital
Yeah,
technologies to communicate with other people? Yes, we could have picked up the phone and called them, of course, written a letter, of course. But I mean, conferences couldn't have happened.
yeah,
Work meetings couldn't have happened.
yeah,
As you say, people couldn't have been digitally present at funerals and weddings and births. They just would have had to have missed out completely.
yeah,
So, I mean, and that this did come out with the people we talked to in Australia. They did, some of them did it. One of them at least did go to a wedding online on Zoom, or another woman to a birthday party on Zoom. And of course, it's not the same as being there. Of course, it isn't. It's not as fun. You know, you miss out. Conferences aren't as much fun, are
yeah,
they? I
yeah, yeah,
mean, and of course you miss out on just the casual chats that you can only really have when you're close to someone and just chatting, having a glass of wine or whatever with them. But the point is, it was better than nothing.
yeah,
And so they did offer at least one way to be involved, even if it wasn't the perfect way or the best way. And I guess the other thing too is that, there has been a lot of talk about, even pre-COVID, about the environmental problems of all the air travel that everyone was doing, both for
yeah,
leisure and for work. And I think that's the fact that we learned very quickly how to do, this type of discussion, doing conferences online, doing meetings with international collaborators online. I used to do a lot of international travel myself, and because I live in
yeah,
Australia, and because most of my collaborators and colleagues are in the Northern Hemisphere, mostly in Europe, in the UK, and some in the Northern America, it was very hard for us Antipodeans, really, because we
yeah,
had terrible, long, arduous flights
yeah,
and awful jet lag. And I don't miss those, I can tell you that much. I do miss seeing my colleagues in person and giving
yeah,
them a hug, but I do not miss that side of things. And I don't miss the fact that, the time it took, but also, I was aware of the issues for the environment of all that travel as well. So, that's another positive thing I think of. I think we've learned over the past 12 months, we've learned a lot as individuals, either as, university colleagues or as just in terms of family and friend networks. I think we have learned so much about the benefits of digital technologies. And, I'm interested to, I've got out of the habit now of jumping on a plane and just shooting off to places. I have thought to myself, how much will I feel like doing it even when
yeah,
it's possible? I may
yeah, yeah,
be much less likely to want to do it, I think. And yeah, I think maybe other people will be reconsidering all the travel that they used to do for work
yeah.
or even for holidays, once we can actually do it again. So I think that will be a big change. I don't think people will want to continue on with digitized funerals or
No,
weddings,
yeah,
but maybe the work stuff
yeah.
will see a major change.
I think what we've also seen is just how inventive people are. And I feel like the longer the pandemic is going on and the longer we start using more technology to conduct, work and study, I feel like the better it gets. And I feel like we've seen a lot of innovation in that realm over the
Mm,
past just couple of months. And what I think is interesting about it is that it like asking what you don't like about Zoom or anything like that really makes you think about what do I like about social interactions I have in real life? What is it that makes them special and easy and enjoyable, which I lack in an online environment? And I think it takes a lot of scrutiny of your normal social life to think about what is it that I don't have on Zoom that I have had in day-to-day interactions with other people before. And like we've seen people who like invent this sort of bar style technology where you can move from different groups just as you would in real life. And once I saw that, I was like, oh yeah, that's something I enjoy doing in real life conferences or meetings. But it really takes me a lot of scrutiny of my own life to see that this is something I'm lacking in online environments.
Yeah, I think so. Yeah, I think sometimes it does take just a sudden change to really shake us out of our everyday habits and assumptions. And another example I would give actually, which is a really important example, is digital health.
Yeah.
Because in Australia we have literally since the 90s been trying to really get telehealth services up and going. Of course, we're a vast continent with relatively small population. There's a lot of people who live in very remote areas, and it's really difficult for them to get to a doctor, and or if they live in even just a small town, there's often just not enough medical practitioners who are willing or able to work out of there. So it can be really difficult to get an appointment, and all those issues have been continuing issues in terms of access to healthcare services for a long time in Australia, and I'm sure in many other countries as well. And so it's often been talked about, oh, let's offer telehealth, but it's for lots of different reasons. It's never really got off the ground. But last year, in a matter of days, a telehealth service was offered by the government. They just cleared away all the red tape. They worked out how to do because we have universal healthcare coverage here in Australia, so they worked out a way for medical practitioners, for GPs and specialists to be able to bill. Well, what happens is they bill patients, but then the patients get the money refunded to them. But anyway, they worked out the whole billing system, which was always, it seemed to be a sticking point, but that all got sorted. And it was really, really, and it was offered to people, and it was really popular.
Yeah.
Of course. And of course, I mean, again, we need to consider the pros and the cons. So introducing a readily available telehealth service is great for access. It's great for people not having to take time and effort and money and drag along small children to go to doctor's surgery. That's all fantastic. And people really appreciate those things, both the practitioners and patients. But of course, not every medical condition can be diagnosed or treated through digital forms. Easy things, easy diagnoses, like renewing a prescription, sure, of course. But in many cases, doctors actually have to be in the same room as a patient to touch them, to hear their voice, to see their body language and body movements, to assess how they move, and all of those things that are really important to many diagnoses. So it's fantastic for a certain group of kind of health problems, but can never offer what a in person for some other health problems. Surgery, childbirth obviously cannot happen.
Yeah.
There is such thing as robotic surgery, but there still has to be people in the room offering care as part of that as well. So I think sometimes I do a lot of work in digital health, and I also see that a lot of digital health solutions have been proposed even before COVID. And I would, as a sociologist, I sort of stand back and say, well, hang on a minute, it's not going to solve every problem. It's not going to offer every solution to every health crisis. Sometimes in some countries in particular, we need things like just clean water, sanitation, vaccination programs, childbirth assistance, trained childbirth assistance, those basic sort of universal health care facilities must be offered before we even start to think about how digital technologies can be brought in. So again, let's when we're thinking about the pros and the cons, we're bringing in the context, we're bringing in the country, we're bringing in the politics, we're bringing in the access, and all of those things that they've all got to be part of the conversation when we think about digital technologies and how they can benefit us or how they can't.
Yeah, I think bringing up health is such a good point, because I feel like I live a pretty, technology intensive life, and I felt like I was really up to speed with most of the technology I used. And I also feel that the UK is a pretty digitalized country, even pre-pandemic, at least compared to Germany, where I'm from. But the health point really hit me because during the pandemic, I was forced to make a doctor appointment at some point. And when I did this, and it was like telehealth, I was just really struck how alien it is to me, how weird I felt about it. I'd never done it before. I didn't know what to expect. And suddenly I felt really just out of my comfort zone, even though so much other aspects of my life are already like digitized. And it was really seamless. And for the issue I had, as you said, it was just absolutely fine. And there was no need for me to go in. But it really struck me at that point, as you said, that this is one aspect of our life that had very little digitalization to it before this pandemic.
Yes, and I'm also working with a colleague. We're looking at psychology offered online as well, and talking to psychologists who, again, were kind of forced to go suddenly, having no experience in offering psychology online, were forced to. And so we're getting the psychologist's perspective there, not the patients, not the clients.
Yeah.
And it was really interesting talking to them because they talked about how it was fantastic that they could now offer more services, because there's always, more people wanting psychological services than there are psychologists to offer them.
Yeah.
But there's issues around privacy, both of the psychologist and the client, because you're doing each in your own home. You can't guarantee that there won't be interruptions or that people can't hear what you're saying. All sorts of really interesting, which would still go over to the telehealth context in a way, except that I think a lot of telehealth services were offered out of doctors' surgeries at least, but for the privacy for the people on the other end of the consultation can't be guaranteed. Whereas when you're entering the space of a doctor's surgery or a psychologist's rooms, you know that that's a private space already. And you're used to that as the client or the patient. You're used to knowing that it's just you and the practitioner there, and that's the therapeutic space that you're both engaging in. But when you bring it online to a Zoom or whatever it is you're using, a mediated consultation, all those things are kind of thrown up in the air. And the psychologists talked about as well that because they couldn't see the whole person's body, that made it, or because there were glitches, as there often are, there would be a pause. They weren't sure if that was a glitch or whether the client had sort of stopped talking. So again, pros and cons. It was great to be able to at least still offer services, but on the other side, the psychologists had to very quickly kind of work with how to conduct this therapeutic interaction with all these other aspects that they needed to be aware of. They talked about sort of exaggerating their body movements, so they felt as if the client kind of felt they were being empathetic. There were just lots of really, and it was all about, how you move your body, how you observe another person's body, what you can pick up about them from the digitized image that you're dealing with, and all those things. Yeah, so very, very interesting to look at those dimensions from the practitioner's side.
Absolutely. I mean, I think we could talk always about this. I want to move a little bit. I mean, it's all interconnected, but I want to move a little bit to another topic you write about, which is valence and technology and surveillance. And you argue, if I get that right, correct me if I'm wrong, that technology and social media increase valence. Can you explain what you mean by that?
Yeah, so valence just means watching. It's a kind of French version of watching. And, there's been a lot of interesting work, particularly drawing on Foucault's work on, I guess, building on his work on talking about institutions like the prison or the asylum. And the way that certain modes of watching people were generated, obviously pre-digital times, and of course the panopticon is it's really a metaphor more than it never actually was a building, but it's a metaphor that Foucault uses, and to talk about how people can be watched, say in the prison context, without with only really being, they know they're being watched, but they can't really see who's watching them, and they can't really know when they're being watched. So the whole idea that Foucault talks about is, and a really important idea, is that people therefore who think they're under some form of surveillance, therefore start to survey themselves, because they're never quite sure if anyone is watching or when. So they just kind of bring in those self-disciplining forms themselves into their everyday lives. And since digital technologies have become very much more ways of, I guess, watching people in that digital traces that people leave behind when they go online or when they use apps or their phones, you know, those data can increasingly be used by third parties, including, and also by people themselves, of course. So if we get back to the whole self-tracking phenomenon, that is literally about people watching themselves, using digital, not always using digital data, because some people do analog, you know, they just use the old pen and paper, but you know, more and more you do have your apps and your wearables to be able to use and monitor your body, and you are conducting self-surveillance. So it is surveillance upon yourself, just to identify patterns in your life, or things you're interested in changing, so that you can monitor if you are changing, you know, how many alcoholic drinks you have, how many steps you take, you know, how much you weigh, those kinds of things. People can easily use apps these days, and wearables and platforms, you know, spreadsheets, whatever they use to monitor those dimensions of their bodies and their lives and their practices and their habits. And then, of course, they can, at the same time, if they are digitized forms of self-tracking, then there is a possibility that the third parties, the owners of the platforms or the apps or the wearables, can see their data and use their data and store their data and manipulate, you know, algorithmically manipulate their data and sell their data for advertising purposes and so on. So that's that kind of third-party surveillance. Dataveillance is a term used in surveillance studies now, more and more, to talk about that form of watching, dataveillance. But then they can use, people can use their own data to share with others, and so they're engaging in a form of, you know, social surveillance, where they're uploading photos or videos to social platforms, or they're uploading their data. This is how many steps I did, or whatever, and inviting others to watch them, really. And I've written about how that can be a really great form of motivation and building social relationships, where, you know, you share your information with other people, they share with you. It's often a very mutual thing. If you look at platforms like Strava, or Runkeeper, they very much sell their platforms as a way of what they call social fitness. And it's very much about sharing your information with others, and it's very much about commenting on others and giving kudos, as they say in Strava, and saying, well done, or whatever. So, you know, that kind of surveillance, mutual surveillance, social surveillance, can be a very positive and beneficial thing for people, and motivate them and make them feel good about themselves. And look, I got king of the mountain, or whatever. I won this segment, or whatever happens. And yeah, it can be a way of, I mean, I've also done research on self-tracking, which talks about how people might not put that information on social media. In fact, they may deliberately not, they don't feel they want to, but they tell their best friend, you know, just on the phone or over coffee. So they can also be shared in an analog way, or with their partner. There might be a bit of, you know, friendly competition with their daughter or mother or father, where they just go for a walk together and each check their wearables at the end of it, you know. So there's a lot of different ways of sharing that it can be both digital and non-digital, or both at the same time, you know. So again, it's an interesting phenomenon. But yeah, that is, I mean, one could argue that is a form of surveillance as well. Then there's also what's called surveillance, which is, you know, from the French underveillance. So that's where people can use digitizing incidents. They might be videos they took on their phones, or photos they took of their phones, for example, where they can observe instances where the powerful exploit their power. So beatings or killings of black people, black men in particular, for example, is the, you know, a very obvious example, particularly from last year's Black Lives Matter protests. When there are people able to go out in public and record these incidents of violence, and share them widely, then that is a form of surveillance. It's the sort of underprivileged being able to watch the powerful.
Yeah. Yeah, I think I wonder, so I think the self-surveillance and self-tracking combination is really interesting. And I really noticed it like just on my very own personal example. When I had a Fitbit last year and, you know, tracking steps, and you do workouts on it, you track your weight and that kind of stuff. And I never felt that I like put pressure on myself. I just enjoyed using it. It gave me motivation. And then it broke. And just not having this device, which told me how many steps I'd taken, which told me how many calories I burned in a workout, just not having this information anymore, I felt like suddenly like I couldn't really estimate what I did. Like I felt like I had a lot of security in these numbers, and they just became part of just these data just attached to the reality. And not having it anymore, it made me question like how I experienced it and if I had done enough steps. And I felt like for a couple of days I felt really detached, I don't know, from my body in a sense, because this data had been so like pivotal, I guess, in a way I didn't think it was. So how do you think the data, do we not realize like how much data also forms and becomes like so integral in the way we experience our bodies in reality?
I think a lot of people who self-track are fairly aware of that, actually,
Yeah.
because I think they do understand, they do know. I mean, when I've talked to them, I've done a lot of research, you know, talking to people who self-track, and they all tend to say that they recognize the motivations they get from the numbers, and they, you know, little jokes about marching around the house last thing at night just to get your final step count, you know, get the little the badge or whatever for your 10,000 steps. I mean, they have a bit of a laugh about that. They're aware of it, and they can see the absurdity of it in some ways, but they also acknowledge that they enjoy getting that badge or getting that little flashing light or whatever their device does to let them know. And it does motivate them to continue on with it. So it can be incredible. This whole metricization can be incredibly motivating. You know, people can often get very upset if they've done a big cycle ride or run and it doesn't, for whatever reason, it doesn't get recorded.
Yeah,
you know,
true,
it can be
true,
really
yeah.
to make you feel, well, now it's not there with all my metrics, and I can't kind of boast about it on Strava or whatever. So yes, I mean, it can, particularly, I guess, if you are trying to go for a goal. If you do have a goal in your head, if you are trying to be the king of the mountain or win a segment or, you know, make a certain number of steps in a certain number of weeks, then the metrics do become incredibly important to all that. And I guess that's why people, you know, take up self-tracking, and those who continue with it. Of course, a lot of people don't persist and just get bored with it, or sort of think, well, I know now how long I need to walk to get my 10,000 steps. So I don't really need my device to tell me, and that sort of thing. But other people who may be a bit more competitive or just enjoy wanting to keep improving, you know, the metrics still remain very important to them. And or they might be part of a little group on Strava or whatever, where they like to all, you know, share each week and stuff. And that's really important to them. It's part of the social part of it. Or, of course, they could have a chronic health condition where it's just incredibly important to continue. They basically have to, because they need to keep an eye on their blood pressure, all their weight, all their, you know, blood sugar level, and they need to engage. Basically, they've been sent home by their doctor and with a prescription to self-monitor, and they can't really give it up, even though, I mean, I have talked to people who are totally fed up with it, but they realize that it's helping their health. And on the other side of things, it's helping them to be, they do feel more, they talk about being more in control of their health. So in that way, it does benefit them, but in other ways, it can get a bit tedious. But they don't really have a choice.
Yeah.
You know?
Yeah, that's so true. I never thought of that, but of course, it's important to realize the privilege and particularity of being able to choose whether to track and digitalize. So I think that's a really important point to make. I would like to end with what I promised at the start, which I think is just such an interesting paper. And I think it shows why sociology of the everyday can be so fascinating, because I mean, I make the bold assumption that whoever watches this probably has at some point watched, you know, a food video on YouTube or Facebook or some form of it. And at least in my generation, I think, you know, cheat day videos, these kinds of things, like most of us have seen it around, no matter whether it's something like you consciously follow or not. So what drove you to write about food cultures on YouTube, and specifically like cheat day videos?
Okay, well, this was a chapter for a book I edited on digital food cultures, and with Zena Feldman, my colleague. And food is another dimension of everyday life I've been interested in again for a long time. So I actually wrote a book again back in the 90s, Food, the Body and the Self, which drew on interviews of people's memories of food in childhood, but also their current practices of food and eating. And I was just interested beyond the health dimensions, what it is that people really found valuable and important about their everyday practices of food. So that is something I've been writing about for a long time. So it began to really fascinate me when I did see, you know, of course, there's many calorie counting apps available, and they're among the most popular of all food apps, as well as the kind of exercise apps. But I also noticed that there's a lot of on YouTube in particular, the sort of how to cook video is really, really, there's so many of them. They're really popular. People just follow recipes, you know, how to learn how to cook. And they might be offered by professional chefs, but also a lot of amateurs who have got a name for themselves now on YouTube. And I can't even remember how I came across the cheat day videos, but I was watching the Epic Mealtime videos, which is the a Canadian YouTube channel, which shows men throwing together excessive meals. They don't actually eat them. They pretend to, but they don't really eat them. The whole point of that is just the excessiveness of the meal that they make. I mean, it's like we're talking about 100 like of McDonald's burgers with gooey cheese sauce, and there's always some bourbon thrown around as well, and bacon, you know, and then they have a calorie counter. Speaking of a calorie counter, as they add more stuff onto this high calorie, it just gets bigger and bigger and bigger. So I was quite interested in that because I'm interested in, I was taught in this chapter, I talk about the carnivalesque and the way that, you know, the excessive nature of this kind of video is a real counterpoint to your Fitspo or clean eating video, which is all about aesthetics and, you know, low calories. This is the complete opposite. This is just completely blowing up this whole aesthetic of clean eating and measured eating. And that's what it's trying to do. It's really just there for fun, right? But then you've got the cheat day video, and I talk about a fitness influencer, Stephanie Buttermore, who's an American. I think she actually originally was Canadian, but she lives in America now, and she's sort of Eurasian, lovely young woman who's also a scientist, has got a PhD in cancer biology. So she's a very intelligent young woman who had a very popular series of sort of fitness influencers, because she's also kind of went in bodybuilding, you know, competitions, you know, bikini bodybuilding competitions and things. So she had an incredibly ripped, lean body for a long time. So a lot of her videos were all about how to achieve this fabulously ripped body, and a lot of the science of it actually as well, because she is a scientist. But then she would have the occasional cheat day video, which showed her driving around town and just finding the most highly calorie, you know, food that she could find, donuts, fast food, and just daintily but vigorously eating, just just constantly eating. And then she'd show herself the next day, basically hardly having put on any kilos, weighing herself. So I argued in the chapter that it really was this ultimate fantasy of, that people, and you could see from the comments that people were just loving this vicarious consumption, because they knew themselves. Most the average person would know if that's how they ate all day. One, they would feel incredibly sick, wouldn't they? And two, she never seemed to feel sick about stuffing herself with all this food. But two, that you can still be incredibly ripped and lean the next day. So I talk about the fantasy dimension of that. But it is interesting, since writing that chapter, I noticed, having gone back onto her site recently, and she has, she's very popular. She has over 1 million subscribers to her site, but she has now sort of relinquished the whole stripped down lean body, and saying that she was sick of having to basically punish herself by the very very disciplined eating that she mostly had to continue for her bodybuilding practice, except for the cheat day, and how she now realizes how unhealthy that was. And now she actually weighs quite a bit more. She's a little bit chubbier and no longer has that really stripped down muscular look, and how she's saying much happier for it. So that's interesting, because she's kind of now turned her back, repudiated, one could say, the whole culture of that starving yourself for that lean, stripped down look.
Yeah, I think it was really interesting for me reading that chapter, because I only knew her like for a couple of months, and from this all in getting back to normal eating habit journey that she shared on YouTube. And I had never seen like how she looked before, like the first time I encountered her videos, when she was on this like journey to like becoming more in tune with her health, not being hungry all the time. And when you know her, like when you get to know her from that perspective, and then you look back on these cheat day videos, you can just so blatantly see how unhealthy it was. And as you say, I think it's really interesting that she now actively sort of deconstructs this fantasy that she was just this happy, lean, ripped woman who, once a month would eat these 10,000 calories on a day, and she would just stay the same, and she's just this like happy life. And now she says it wasn't that happy after all. But what she said in one of her recent videos on this like journey really struck me, because she said that the most criticism she received on trying to become more in tune with her body was from men, and that there was so much judgment from male viewers, much more than from female viewers. And it made me think about how gendered food consumption is, how much food consumption has to do with other prejudices we hold in our lives, I guess. And I don't know, maybe we sometimes, do you think we underestimate how much of this prejudice and social politics like is implicated in food, even on YouTube?
Well, when you say even on YouTube, I think YouTube and Instagram's another really important example of how bodies are represented. And I have written about fat. I've written a book called Fat, which looks at fat politics and talks about why it is that we as a culture, in Western cultures now in this period of our history, have so much disgust for fat bodies. And which includes the way that fat people eat and what they eat. They're always judged. They're always judged for anything they put in their mouths. People talk about surveillance. They're under surveillance and judgment all the time because of their fat bodies. Now, in a way, Stephanie Buttermore, in having this very popular YouTube channel about fitness and about her body and about her, leanness, but also her cheat days. She was kind of positioning herself already within those discourses about what are appropriate female bodies. And of course, it's very hard as a woman, and particularly a young woman, to kind of have the right balance between the fit, ripped, lean body and the fat body, because of course a lot of women bodybuilders get a lot of judgment from men in particular about, too masculine, you don't look like a woman, too much muscle, not enough fat, not enough curves. So, and it's interesting that the Fitspo hashtag, which I have also written about on Instagram, you know, the women there and men, they're both men and women, but the women in particular are very sexualized.
Yeah.
And so, I mean, Stephanie Buttermore was as well. Her videos were as well. You know, it was often very, very flimsy clothing we saw, very revealing clothing, often bikinis that she wore. She was very put together, you know, makeup, the whole thing, very highly groomed woman. And you see that on the Fitspo hashtag on Instagram too. They're always young, fit, but not too lean, not
Hmm.
too muscular, but toned. You know, again, it's a very, very narrow
Yeah, true.
boundary about what the appropriate, attractive young female body should look like. And it seems like any deviation, one too skinny, no, you know, too muscular, no, too fat, too chubby, you know, it's such a narrow definition, which of course most people, and as Stephanie Buttermore points out, it was very difficult for her to keep that up,
Yeah.
and it actually damaged her body in many ways. She talks about that, trying to keep up that, trying to find that right balance. But of course, many young women are faced with that. But of course, young men have a similar problem in that they can't be too
Hmm.
thin or
Yeah.
fat. They must be muscular, but not, I guess, too muscular, which begins to look a bit ridiculous. You know, they're a bit too kind of chunky. So I think it's both men and women, but I think probably more women than men for that because we just have a history of being far more judgmental about
Mental.
women's
Yeah.
bodies.
I mean, I guess why I asked that question is because when you watch, I don't know, Jamie Oliver cook bolognese on YouTube, right? You can have the impression that food is just this easy breezy thing that just everyone enjoys and it just brings joy to everyone and it's just this like happy thing for everyone. But I guess, of course, what this hides is that food is, I don't know, joyous and easy breezy when you're white, you're wealthy, you're male, and for whenever you deviate from these standards, food can become all but joyous, I guess. And I think I realized that when she talked about her journey, and how we sometimes, I think, don't realize just how invested we can be in food and what meaning food can carry according to our social position.
Yes, well, Stephanie Buttermore, she does talk in her latest videos about, yeah, just how unhappy she was trying to, well, she just talked about how she just constantly starved herself. And in fact, the cheat day videos was, you know, the one opportunity where she could eat where she wanted and didn't feel hungry that day. But she said every other day she went to bed feeling hungry. She does have an amazing capacity to eat, I've got to say, having seen the cheat videos. But she does talk about that. She said ever since she was a young child, she just had an amazing appetite, a really big appetite. But she had to constantly, basically, not feed that appetite.
Yeah.
So there's been a lot of self-denial in her life. And it's really interesting to see that she finally did just decide she wasn't going to have any more of it.
Yeah.
But as you say, also having a black backlash. But I think she's also got a lot of positive
Yeah.
feedback as well. So that's good. And she does seem still very popular. Her videos still seem very popular now that she's talking about this change in her life. So she's probably giving a lot of help to a lot of people who are struggling with body image, I would imagine. She's kind of now turned into a body image influencer
Yeah,
or
true,
a
true.
Fitspo influencer.
I mean, this ties nicely in the last question I want to ask you, which is, I guess, about responsibility. And so, I mean, you mentioned, these videos, they get hundreds of thousands, if not millions of views. And Stephanie Buttermore was by far not the only person talking about food and health and fitness on social media and on YouTube. Millions consume this content like every day. And maybe in a like life imitates art kind of way. I wonder, does Stephanie Buttermore bear a real responsibility for the kind of consumption and body she shows? And she says she's now a very positive influence, hopefully, for many people, but should we hold her accountable for like holding up a fantasy before? Or is she just is she just part of a culture more generally, and it's not, we shouldn't single her out?
Well, I think we have to make a distinction between someone like Stephanie Buttermore and somebody like some of the influencers we see who have claimed to have been cured of cancer, for example. We have a very controversial influencer called Pete Evans here in Australia,
Right.
who's a well-known chef. That's how he first became known, and he was on a reality cooking program as a judge. But he's also known now for his pushing the paleo
Right.
diet, and he got in a lot of trouble when he wrote a cookbook for paleo cuisine for babies and toddlers,
Right.
and the Nutritional Association of Australia basically said, look, this could damage children's health if that's the kind of food you're advocating they be fed at that age. And he's since become even more controversial because he's become a conspiracy theorist around COVID, and he's just gone a little bit kind of,
There's a very similar
more
case in Germany, actually, about this vegan cook who is now like all embroiled in COVID conspiracy. Yeah.
Yeah, so I would say at the level of responsibility and damaging kind of messages, Stephanie Buttermore is way below those kinds of people.
Yeah.
And and Pete Evans is trying to commercialize. Well, I suppose Stephanie was as well. I mean, she was making money from her YouTube channel, but I think one needs to kind of look at I don't think they should all be tarred with the same brush, right? I think, Stephanie Buttermore, I think, is a young woman a very high achieving young woman, obviously, with a PhD and so on. And just, I think part of her quest to be, bikini model, body weight champion, bodybuilder champion is just part of her personal kind of drive towards excellence. And of course she did, being part of a certain community which emphasizes looking attractive and having that ripped body, but also being part of American culture anyway, or North American culture. I wouldn't want to throw too many stones at her, let's say, but someone like Pete Evans, yes, I would happy to metaphorically throw stones at him.
Yeah.
Or someone like people who have claimed that they've cured their cancer. That is just very direct exploitation of people's gullibility.
Yeah.
I don't think Stephanie Buttermore was doing that at all.
Yeah.
I think she was generally trying to help people and be a role model. So yeah, I think we need to just kind of weigh up each individual case and not be too quick to judge.
Yeah. All right. I think we've exhausted our hour, and I think we talked about so many really interesting things. Thanks so much for coming on today. And I'm really looking forward to your new book. And I mean, your variety of research in the past just promises even more interesting things in the future. So thanks so much for being here today.
It's a pleasure. Thank you.